Hello, everybody, and welcome to Ben and Nate's Questions That We Ask Massage Therapists on the Internet. And it is good to be here with my good friend Ben Stone. I am Nate Fay. I'm a massage therapist, osteopath, and I am a nationwide, worldwide instructor for Dalton Musculoskeletal.
And my name is Ben Stone. I am your co-host to Nate Fay. I've been doing massage for 20 plus years. I'm out of the Midwest. I do all kinds of stuff related to massage. One of the things I love to do most is ask massage therapist questions on the internet. That's why we have this show. So here we're back at it. We're on episode number 30.
I think we're at 32 tonight.
I think we're episode 32.
And for those of you that watch, Ben and I joined each other live a couple weeks ago, and that episode just went up, and that was a pretty fun experience. It was our first podcast with an audience, so that was exciting.
Yeah, Nate and I got to be together, and man, that was fun. I think we're gonna have to do that again in the future.
Well, Ben, I think we are going to have to do it in the future. And as a matter of fact, Omaha was so nice that I got to go there twice. So that means I'm going to come back the weekend of November 1st and 2nd. We're going to be in the same place, same location, except we're going to come in with a different musculoskeletal class called prone, supine, and side lying.
That's fantastic. You heard it here first, Omaha. Well, maybe you hear it somewhere else, but you're going to hear it here too. That's November 1st and 2nd, 2025. Man, reserve your spots now because I have a feeling it's going to fill up.
That's right. That's right. So, hey, Ben, what's new in your world, buddy?
Oh, man, snow has been falling across the country, and we got about 4 or 5 inches of it today.
Okay.
And it reminds me of a question, and I'm going to ask you this, Nate. What do you call a reindeer with no eyes?
Ben, what do you call a reindeer with no eyes?
I have no idea.
Yes. Another good one, man. Another good one. It's snowing here right now as we speak, which makes me a little anxious because I'm getting on a plane tomorrow morning. And yeah, we want to get to our place on time. So
planes and snow it's just not fun sometimes.
We'll see. We'll see what happens. But it's going to be one of two things. I'll text you and say, hey, Ben, we made it. Or I'll text you and say, I'm laying in bed crying in my soup. It's going to go either way tomorrow.
Yeah. What's new in your world?
What is new in my world? Well, of course, I came out and had an amazing class with you and the Omaha crowd. And I think I got to try, I think I ate probably what was like a real steak, for the first time.
You ate one of the biggest steaks that I've seen anyone eat, and you downed it, and I was impressed.
I feel like if you're going to come to Midwest, like it's like if you go to the South, you have to get barbecue. If you come to the Midwest, I mean, you just have to dive right in.
Yeah.
So other than that, but been healthy and working hard at my practice, man. How about you?
Yeah, right on. We kind of delayed recording a little bit because I got sick, had the flu, influenza A, but I am on the mend and doing better. So ready to get back on the recording schedule. Ben and Nate's Questions We Ask Massage Therapists on the Internet.
Yes, we did not go away, but 2025, they say 2025 thrive, and it sounds like it's been a little bit of it's been a rough start to our year. Ben's got sick, and of course, on a probably a tougher note, everybody knows, the world knows by now that we lost our good friend Eric Dalton back in January. So we wanted to, people have been putting out some really nice words and tributes, and Ben and I wanted to take a couple minutes before we get into our podcast and reflect on maybe a cool Dalton moment.
Yeah, there's been so many cool things that I've learned about Eric Dalton since he's passed. All the stories people have shared, and it's been really cool to see. And so I'll just share one of mine. One of my favorite memories is a couple years ago when Eric Stevenson was a guest speaker at Oklahoma City. We had an after party, and it got crazy. and there were songs and singing, and boy, it was one of the most fun things. I mean, I saw Eric just having a blast. Art Riggs was there. There were a bunch of people there that it was just it was a fantastic time. And I'm going to treasure that night, probably forever. How about you, Nate? What kind of things do you want to share about Eric?
That was a fun night, man. That was Oklahoma City. I think that was 2019, 18 or 19. I think it was 19. And yeah, at the after party, Eric Stevenson brought his guitar out and singing tunes, and Dalton was drumming on a table behind him, holding it down. And like you said, it was like the who's who of the massage world, and everybody else just hanging out. And only Eric could do something like that, which was so cool. It's like you always say about hockey games, I'm going to go to the fights and hope a hockey game breaks out. And, with Dawn, it's like, hey, I'm going to go to this huge party and maybe a massage conference is going to break out at some point. And that's how I learned to think about them. I was, we're doing a nice article for Massage Magazine, and I was just writing down some thoughts before you and I got together, and she was asking me about his music career. Eric had so many cool stories about his music career. And she was asking me to pick my favorite one. And people will talk about Eric's time in the Flying Burrito Brothers, which most notably Graham Parsons, that was Graham Parsons' act for a while. Although when Eric toured with the Burrito Brothers, Graham Parsons was no longer with him at that time. Eric did a small European tour. But more notably, I think some of the cooler acts that Eric played with was a band called Southwind and a band called Fast Fontaine. And his band Fast Fontaine had actually gotten signed to a major label, EMI, and Paul Rothchild produced their album. Paul Rothchild notably produced Janis Joplin's song "Me and Bobby McGee" and Crosby, Stills and Nash as well. But my favorite Dalton story that he would tell me is, those were all great. Those were all amazing stories. But my favorite one was he did a backup gig with Waylon Jennings. And Waylon Jennings, of course, that was back then, some what they would consider, that old school cowboy country.
Yeah.
And this was in Las Vegas, right? Mafia run Las Vegas.
Wow.
Movies like Casino and Goodfellas that were all loosely based off that time frame. And Dalton's in the green room, and they're all waiting to play. And Eric Dalton wore a cowboy hat. And Mafia run Las Vegas. He says these guys in a suit came up to me, and I'm not gonna quote what Eric said because there were some expletives in there. We still have to keep this a PG show for Spotify. But they said, Eric, they said, hey, who are you? And Eric said, well, I'm the drummer. And they say, well, what the F are you doing? And Eric's like, what do you mean? I'm backing up Waylon tonight. And they say, Waylon wears the effing cowboy hat. Take it off now. I said, Eric, what did you do? And he goes, I took the cowboy hat off. So
Oh, that's
I don't know
hilarious.
why that story just always rings in my mind. And and then like I said, my tribute. And then there was, his illustrious bodywork career. He
Yeah.
lived, I think Eric lived 3 different lives. And we miss him.
That we do. I definitely love hearing all of these stories that are coming out, stuff. I only had a chance to know Eric for a few years. But I would love to say, if anyone has any stories they want to share, just comment down in the comments. We'd love to
Yeah,
hear
absolutely.
any of your favorite stories of Eric Dalton.
And the good news is, Ben, we had a formal meeting about it. The good news is we want everyone to know that Dalton Musculoskeletal is going to carry on. We're going to carry his work on, and even better, right? We're actually going to reincarnate the Oklahoma City workshop this summer. And it's going to be like the old days. So guys like James Wozlowski and Massage Mentor and a bunch of people are going to come out to that. We're going to just do a big teaching event and tribute to him. And then we're going to continue on his annual Costa Rica retreat, Pain Relief in Paradise. And we're going to continue it for its 26th year. And that's going to be under the direction of myself and my good friend, Scott Doss.
Boy, that's fantastic. That's wonderful. It's good
Yeah.
news. I love it.
That's all great news, all great news. And,
Yeah.
that's exactly what Eric wanted. So we're happy to say that. All right.
Wow. All kinds of good
Yeah,
news.
man.
Nate Faye's coming to Omaha. Nate Faye's taking charge of putting together Oklahoma City, Costa Rica. Man, 2025 is just gonna shape up to be a great year.
Yeah, that's right. That's right. Kim Miller, our director of education, man, she's leading the charge on that Oklahoma City workshop, and it's going to be awesome. It's going to be everything Eric would want and then some. So, yeah, man. So, in the middle of all this, we got a podcast tonight and we got a topic tonight. So, what is our topic?
That's right. I lost my notes. Why don't you read it off? Do you have it available, Nate?
I do. Let me, we'll put a little pause here. The question that was asked is, what has been your red flag moment with a client? Here's an example. Your client comes in with low back pain and you feel it is something beyond a musculoskeletal issue. How did you handle it? And what did the issue turn out to be?
Wow. That is so many things go through my mind when I hear that. Have you ever run across anything like this, Nate?
I did. I had, to my knowledge, I had it happen 2 times in my career, and I was certainly thankful both times whenever I think about it, that in those moments that my clinical and critical thinking cap was firing on all cylinders that day, to know that perhaps something more was going on. And I think before we get into this, because this could potentially be a heavy conversation, that we talk about these things. I'll say we talk about these things to you know tell other therapists, right, that this stuff exists, but maybe the odds of it coming into your practice are hopefully going to be low. But it's just a good reason that we should always be sharp and not assume everything is because of a muscle, bone, or a joint.
It's a scary thing to think about that there may be something we don't see. But one of the things that keeps me going is we do the best we can with what we know, and when we know better, we do better.
That's
So
right.
it's we're not always going to catch everything, but tell me a little bit more about what you because I remember some stories that you've told me, so I don't know if you're going to repeat those, but I want to
Yeah,
hear
probably.
what you came across.
Well, my first instance was early on in my career. I hadn't even opened up my sole practice yet. I was still working under a direction in a chiropractic office. And I had a gentleman referred over to me for low back pain. And it didn't make any sense to me because he'd been treated for 6 months with no positive results. So that to me was like, okay, that doesn't, 6 months of low back pain, you're not getting any better. I know he had really good care. So I know that the people that were treating him were really solid therapists. And, so I had asked him, I said, well, have you ever talked to your doctor about this, right? Have you ever gone to your PCP, got an x-ray or anything like that, just to make sure nothing else was going on? And he had not at that point, and I guess it was something that hadn't been thought about. And he was there, and I said, I know I wasn't going to do any harm by working on him there. And so in that case, I worked on him and I said, hey, I'll see you in 2 weeks, but in the meantime, go to your doctor and let's just try to hash this out before we really continue into any sort of treatments. Well, he got right over and did it. And it turned out he had stomach cancer that was representing as low back pain. And with that being said, that was a pretty harsh one because in the same sort of sentence, he said, I'm not going to live another month. And I was like, me being me, I was like, no, you're going to be fine. Like, you're going to, and trying to be encouraging. And really, it was like being blindsided. And he died pretty quickly. I think he was gone within like 2 weeks of that. So that was a tough one. And again, that was probably a rare thing that most people aren't going to experience. And the second time it happened to me, of course, now it's years later and I'm a little bit even more on guard to stuff. And I had a gentleman come in that was low back and hip pain, very nondescript, so very like nondescript in the story and no mechanism of injury. It didn't really make sense. I mean, he fits some maybe criteria of like maybe if we got into blaming like age and lack of exercise and things like that, but still. And, assessments are always an interesting thing. You and I have talked about assessments on our podcast, and assessments are a small piece of the puzzle. They're not the whole story of being 100% accurate. I mean, as a matter of fact, most time assessments have very little accuracy, but it's enough to maybe help us out. And anyway, nothing was showing up in any sort of assessments I did. So I kind of pulled the same, and I wasn't feeling anything. I wasn't finding anything. He wasn't really checking any boxes of what I felt should be, a manual therapy session. So I was like, hey, why don't you just go see your doctor just in case, and, before we really continue. And he had bone cancer.
Wow.
And in his case, that was more of a positive story because it was caught really quickly. And I think he had a successful outcome after that. So that was a little bit more of a positive. I mean, sure, negative diagnosis, but positive, like, hey, we were on it. He caught it early. And that was that. If you deep dive into Google and some of the medical journals, there's quite a bit of stories, particularly in the physical therapy world, of people being overtreated and treated for too long, what have turned out to be, pretty life-threatening issues.
Yeah, I think if some of those issues go, I'm going to say ignored. And I don't know how you feel about this, but I kind of feel like, the stuff that we do as manual therapists is probably not going to hurt most people, if they do have an underlying issue. Say, there's a lot of, I don't know, internal issues that present as low back pain. We're probably not going to make those worse, but I don't know how you feel about that because I've run across a few things where like some endometriosis, that kind of thing. I
Right.
don't really think the stuff that we do is going to make it worse, but when you see that it's not getting better and not getting better and you just keep ignoring it and not continuing to ask the questions like
Right.
why what's going on here? um I don't, what are your thoughts on that?
Yeah, you bring up a really awesome point, Ben. I agree with you completely. I also believe that we're not going to further anyone's potential progression of something. But what I loved what you said was knowing when to call it quits in therapy, and being the type of clinician that says, hey, you know what? We've done everything we could, let's look into another option. So that with that being said, I do have a magic number of treatments when I work with somebody. So we'll just stick with a low back pain story. So someone comes in with low back pain, and let's just say I'm not smelling a rat, and I move forward with treatment. My rule is about 4 visits, 3 to 4 visits. If by the end of that third visit they're not really not making improvements, we'll get to the fourth visit and probably, hey, you know what? We tried, here's my recommendations. And that's not necessarily under the issue of what I would suspect is a red flag issue, but more or less like, I think we've done everything we could. I want to get you the help that we need or that you need, and go for a recommendation or referral at that point with them.
Yeah, because I don't like to be the only person that is treating them. It takes a team, and
Yeah.
for them to rely solely on me, I repeat this weekly in my office. I'm not a doctor, so we need to go to someone that knows a lot more than I do. So I mean, I can give you ideas based on assessments, but we need to flesh this out further.
Yeah, for sure. And unfortunately, and this isn't playing the blame game on anybody or one profession, but unfortunately, people are treated far too long and far too many visits before, someone decides to throw in the towel. I mean, sometimes that's 3 months, 6 months of care, 9 months of care, and people are waiting for that magic number of they're going to wake up one day and be better. And not to get off topic here, of course, another spin-off episode, right? all in the words of what we say, right? So when people are given time frames of something, right? It's like when you broke your arm and or you have a shoulder surgery and hey, in 6 to 8 weeks you're going to come out of the sling. So in 6 to 8 weeks you expect to be, you know, boxing at that point, and now all of a sudden you have a frozen shoulder and there's another issue. Or hey, we're going to put you in 3 months of, fill in the blank type of care. And you're thinking, okay, in that 3 months, I'm going to wake up and my low back pain is going to be gone. So people get
Mhm.
those kind of things in their head based off those numbers. And that's why I like to go for a low visit ratio. That's why I'm like I said, 3 or 4 visits, and you got to be making like some pretty good improvement for me before we look into those other options. And if a team's warranted, like you said, I agree with you. Most people, most people, whether they know it or not, need a team, whether they choose to or not. Ultimately, that's right. That's between you and them and everybody else.
Yeah.
What about you? Have you experienced a red flag situation?
Oh, a lot of the things that I come across usually have already been identified. So I'm grateful for that. I'm gonna say um, skin cancer. I see a lot of stuff that concern me, and I make a suggestion. They say, "Oh yeah, I've already had that checked out."
Cool.
A lot of that stuff has already been checked out. There was an instance where I probably didn't catch it, and so I'll talk about this where I think I failed on this one. I
Mm.
had a gentleman come in. He had some kind of oral surgery done 2 weeks prior, and that kind of it raised some concerns. But I was like, well, we're working on his low back and his shoulders. We weren't doing any jaw work or anything like that. So I was like, well, it'll probably be okay. He said it was okay, that he had healed up. They had cauterized some stuff inside of his mouth. Well, as he was face down, it took about 10 minutes. He started bleeding profusely,
Oh man.
and ended up we had to call. I don't know if we called an ambulance or if we called his wife, but he ended up going to the emergency room to get that taken care of. So that was one of those things where I was like, well, it's probably going to be okay. There was a little bit of a red flag kind of waving in the back of my head, but I'm like, well, he said, and that's another thing, is what clients tell you and what actually happens. I think sometimes they're going to tell you what you want to hear so that they can get on the table.
Yeah.
And that's one of those things where I've learned to be a little more cautious. And, since then I have turned people away, because of that incident. You learn the hard, or at least I learned the hard way, so I'm
It's
not going to make a mistake like that again, I think.
my Shauna, everybody knows Shauna. She comes out with me to different workshops and everything. And I live with her, my fiance, Shauna, the
She's
best.
great. We love Shauna.
So we love her. One thing that Shauna always says to me is, what a compliment it is, right? That people show up at our doorstep with some way beyond our stuff and way beyond our scope of practice. But that shows how much trust people have, people like you, people like myself, and other therapists listening, that they think that we're they think we could fix anything, right? Like we've got to fix for anything. And to the point where on the inside, I would never laugh at somebody. I mean, it's certainly comedic on the into the inside of my brain, hearing some of these stories and thinking that, oh my God, I can't believe this person's in my office with us right now. But certainly a compliment to us and to anybody else that's had that experience. But it's like you said, reading between the lines of their story, because you said it right. They'll do anything to get on our table and hope that we're going to be the answer versus something perhaps in their mind scarier, right? Going under the knife, going under whatever scenario they made up in their head. This wasn't really a red flag. This was just sort of one of these comedic type stories, and funny, not funny. And I had a young woman, I told the story in Omaha. I had a young woman that I treated back a while in high school when she was in high school. And now it's fast forward. She's a nurse. She's in Colorado. She had a ski accident a year ago in February, and she comes back to Connecticut, wants me to take a look at her hip. She said she hurt her hip skiing. And so she comes in, and the story was, well, she fell skiing, and her butt fell on sort of a jagged rock that was buried beneath the snow. Well, it didn't take anybody, as long as you had vision. I think Stevie Wonder would have seen this. That, that her butt, her glutes were rolled over onto her side. And I said, does it look like things are moved over and rolled over on you? And she says, yeah, but I just hope you can rub it out and put it back into place. Like, Nate, all you got to do is put it back where it belongs,
Like
right?
the Mr. Miyagi.
Yeah, right, exactly. And but amazing. She was in great shape. She's a nurse. She's exercising. And I said, well, what's your pain complaint? She says, well, it just throbs at night. And full gluteal tears are a pretty rare thing. I mean, at least I found one case, and I Googled this for hours, and I found one real case of this. Anyway, I said, well, listen, you're in Colorado. You probably have the best orthopedic surgeons in the world in Denver, Colorado, ski country, and you work at a hospital. So why don't you go talk to one of these folks? And she did. Well, it turns out she had complete tears of all the dermal layers, and they had rolled up like a curtain onto her side.
Wow.
Unfortunately, now she was looking at plastic surgery, which convincing the insurance company, that's a tough case.
Yeah, that could be a whole nother spin-off episode there,
Yeah.
insurance.
Yeah, but
Wow.
again, man, people come to us, and it's Ben and I always say, man, it's okay. Learning to say no is like the most empowering thing as a massage therapist, right?
Yeah, I'd rather send someone away and find out that nothing's wrong than
Right.
to, mess something up and have them, have it get worse.
Yeah, and that's actually a great thing to say. And I'll say to people, like, when it's time to like get them out and go see their doctor, or go get, what I think is, go get further studies done. I actually say to them, I hope I'm wrong. Like, I would rather waste everybody's time and money to hope that I'm wrong, but I'd rather, just get it hashed out and see what's going to happen here. So don't ever be afraid to do that.
Yeah, absolutely. So what about I think we had some responses on our Facebook page. Did you have a chance to look at
We
any of those?
did. We did. We got a few really nice responses. Of course, the last one was back to what we just said, man. When in doubt, what do you do?
Yeah,
Refer out.
refer out.
Refer out. Check it out. Refer out. So, we want to fix everything, right? And one of our listeners goes on to say, like, sure, it's cool to be the fix it guy. We know that we really don't fix stuff, right? We're just like facilitators and giving education and doing our best conversation with our hands. But we only have so much capacity, right, to do what we do best. And other things, she goes on to say that she's had clients with severe neck and shoulder pain, and it turned out to be quadruple bypass time, right?
Wow. Yeah.
Lower back pain, multiple myeloma, right? So similar issues to what I found, right? So, right, listening in a picture is worth 1,000 words. This person here, oh, here's an interesting one. I've actually encountered this before. It's pretty similar, right? So one of our listeners goes on to say, client comes in, did some assessments with them and found some, fluid or edema in the adductor tissue, he said, and had him go to the hospital, and turned out he had a avascular necrosis of the hip, right? And so that's actually a common one. And I want to just expand on that. So you might get young people in your practice, right? and that might complain of hip issues, right? So it's always good to check in with, past abuse stuff because alcoholism, intravenous drug use can lead to deterioration of the hip and cause what's called the avascular necrosis. And I've come across that staggering 6 times in my practice. Oddly enough, Ben, over the past 2 years, I've had 6 cases of people under the age of 50 walking into my practice and ended up with hip replacements.
Wow.
Pretty wild, right?
Yeah.
And what else? So that's a good one. That's a good one to tune into, right? Tune into somebody's past. That's why I like to get a good story and hear everything, even if they don't think it's relevant. I say, tell me everything. Even if you don't think it's relevant, tell me. Except for your shoe size. I don't care about your shoe size.
Yeah.
Let's see. Another person, let's see. Yeah, so same kind of thing, presentations of different types of pain and turns out to be, a severe spinal pathology and disc, even severe spinal pathologies that maybe you're not versed with, which that could be along the lines of what we call a yellow flag, right? So we're going to see common conditions, orthopedic conditions like stenosis and spondylolisthesis and variables of that. So knowing what those conditions are and minimally how to position somebody and work on somebody so you don't exacerbate their symptoms.
Yeah, there's so many different things that could pop up, and you know, there's no way that we as massage therapists are going to know everything. And I think
Right.
the big thing is just to know if something's not jiving, maybe look into it a little bit more, refer them to somebody. You can't force them to go to the doctor, but you could say, "Hey, I think it's best if we don't work with you until you get this checked out by somebody."
Yeah. Yeah, for sure, man. And have you ever had the experience, Ben, where someone's gotten mad at you for that outcome?
Never.
Upset? No, no one's ever gotten upset with you.
They
Yeah,
might get a little frustrated, but
sure.
yeah, I've never had anyone get upset with me for it.
Yeah,
Because I present it just like I hope I'm wrong. I hope there's nothing here.
totally. Yeah, people are going to get upset. They're going to maybe get a little freaked out. I've never had anyone mad at me. I've seen people get visibly angry, not towards me, but all of a sudden they're coming in for what they think is a simple thing, and now it's potentially snowballing for them. And but that's okay, coach them through it, let them know that everything's going to be okay, and that they're going to get the answers and the help that they need.
Yeah.
I had a guy recently. I had a guy recently a few weeks ago, longtime client. I hadn't seen him in a long time. And man, we should have had Ruth Warner on for this for this podcast. And he had been getting some massage work with somebody else for his knee. And he was getting swelling in his knee, and he was hoping the massage therapist was gonna, change the appearance of the swelling. Well, it did the opposite, and his lower leg completely ballooned up, and the skin was real tight all the way down. And I've known this guy off and on for a long time. And I said, well, let me look at your leg. And again, it was pretty upsetting to see, and I was really worried about him. And I said, buddy, I'm like, just go to the hospital, man. And he got upset because now it's a total interruption to his day and his afternoon. And nobody else has told him this. And anyway, it turns out that we did the right thing. And he did go. He listened to me. He argued with me and he said he wasn't going to go. I said, well, I can't make you go, but I also can't promise, how you're going to feel in a few days either. And he texted me an hour later and told me that he was glad he went, that he had a pretty serious issue. So
Yeah.
scary,
It's
man.
it is. It makes things scary to know that we're gonna run across those things and we may not even find those things. Um, and that's the scary part. But again, you do the best you can with what you know.
And Ben, we're gonna run across this, I think, more, right? Because in the world of massage, right, more and more people are turning towards us for pain complaints. We're not the luxury service that we once were. We're not the relaxation service that we once were. And yes, that stuff still exists and absolutely should still exist. But we're gonna have more and more patients coming in with, complicated conditions, And we just got to keep raising the bar for ourselves and for each other.
Yeah, absolutely. Um, Boy, there's a lot of stuff that we could go into, but I think we should talk about some big takeaways. What do you think about that?
I love talking about takeaways, Ben.
All right.
I do.
What kind of big takeaway do you have after everything that we've talked about so far?
Well, I love when you and I are just sort of in rhythm in terms of agreeing on certain things. So I think my favorite thing was you bringing up the point tonight about just kind of having a rule for yourself and at what point should you potentially, refer out, maybe you've treated somebody a few times and you're not getting anywhere with them, or maybe something's not jiving with you and learning how to have the conversation appropriately with your client. How about you,
Absolutely.
buddy?
This goes back to something that you talk about a lot, and we have the luxury of time with people, so we're able to get deeper into the story, and I think that's helpful. I do see, I'm going to say on the internets where massage therapists will, they stayed at a Motel 6 and now they know everything. They know more than, board certified doctors do. Um, and, that's probably a topic for a whole nother episode. But um, just remembering, like, hey, we only know so much. And we have this luxury of time with people. So use it to get to, you know, does the story jive? Is it jiving with what we're our goals are and what our outcomes are? And if not, like you said, put a time limit on it. I like that. Putting a time limit on it. If we're not seeing any difference in about, 3 to 5 visits, let's look at maybe referring on.
It's an interesting thing too, Ben, not to carry on with this, but you know, somebody said to me the other day, right? And I bet you hear this. We're far from doctors, right? So nobody's saying that. We're not armchair phys, sometimes you can play that armchair physician, but we don't do that. But it's interesting. I had a client say to me a couple weeks ago, they're like, "Man, we kind of have to know a lot though, right at the end of the day. We kind of have to be versed in, common, common conditions of the shoulder and the neck and the low back and the foot and the ankle, so on and so forth, and the ins and outs of those, have some good assessments under our belt, and then we can get further. Somebody said to me the other day, oh, they've been having jaw issues. Do you know anyone who could look at my jaw? And I said, oh, I could look at your jaw. And they're like, oh my God, I didn't know you did that. So it's kind of interesting, right? That in some ways we still have to we have to keep advancing our knowledge, about the human body and human anatomy. And of course, now it's like you almost feel like you have to have a master's degree in neuroscience to be a massage therapist these days and psychology. And it's just like, when does it end?
Yeah, it never ends. The quest for knowledge never ends. One of my favorite quotes, I forget who says it, but it's the larger the island of knowledge, the longer the shoreline of wonder.
Yeah. Yeah, that's good. The truly educated never stop learning, right?
Yeah.
Yeah. Well, I think this was good, man. We should have invited the queen of pathology herself, Ruth, on this show. Ruth, if you're listening, we'll get you on the
Yeah,
next
I
one.
had a chance to talk with her at one of the Oklahoma City workshops, and so it'd be great to get her take on what she does. What's that called that she does, that podcast she does? I have a client who.
I have a client who,
Yeah,
right? So shout out to Ruth, man.
that would be fun.
Hey Ben, you posted a little bit on Facebook. Sounds like there's a lot of exciting things coming out to Omaha and a bunch of classes that you're going to be taking. Tell us what you're doing in the upcoming months.
Oh man, I get so many people that ask me where are you going? What are you doing? And so I just put together. This is definitely not my final list, but Boy, I don't even remember everything. We've got some good classes coming through Omaha. We've got Lynn and Ann Teachworth who do,
Oh yeah.
and I forget what it's called, structural dynamics or something like that. But they're really good, and they're going to be talking about, I think, low back issues. That's a 3-day workshop, and they get really detailed. Those are
Cool.
really fun. Who else is coming to town? Eric Stevenson is coming to town. I always love when he comes to town. We've got a representative from Doug Nelson and Precision Neuromuscular
Oh
coming to
yeah. Yeah.
town. I don't know if that one's going to be on head and neck or what that's going to be on, but that'll be a good one. The
Cool.
Omaha School of Massage Therapy has been really good at bringing quality education through. They bring James Ozlowski through every year. So there's a lot of good stuff coming through Omaha.
Good. Good. Love it. Love it. Love to hear that your region is growing with continuing education, man. That's awesome.
Yeah, and I love reaching out to people like you. I've helped in the past to bring in some education where we look at cadavers. I think they call it a prosection, not a
Yeah.
dissection. So you review anatomy on cadavers. I mean, there's all kinds of stuff in and around the Nebraska area. So yeah, I'm digging it.
And what about you, Ben? Are you teaching a class anytime soon?
I what did I teach? I taught in November, and since I had the flu, that kind of threw things off. But hopefully, in the next month or two, I'll be throwing out a class on ethics, 3-hour ethics class. So I'll be dropping some more information about that in the near future.
Love it, buddy.
How about you,
Hey,
Nate?
this.
Where you at in the next couple weeks,
Oh well, let's see.
months?
I'm doing a class in 2 weeks in Fraser, Pennsylvania, right outside of Philadelphia. And we got a sold out class in Fraser, PA. So we'll have a bunch of students there. We'll have a good time talking about assessments and musculoskeletal alignment techniques. And then I'm going to 2 weeks later be in Warwick, Rhode Island. We've got a few spots left. I'm going to venture on and I'm going to do a class up in Canada, at the Carden factory. And that'll be in early April. And then I'm going to finish out my season in early May. And I'm going to do something different. I'm going to do a class up in Maine and do it at a resort called Sunday River, which is one of the famous ski resorts up here. So I thought that would be kind of fun. And then we'll take it from there.
Boy, that sounds fantastic.
Yeah. So we both got a lot of exciting things, man. The massage world is booming and growing. So get yourself out there and take a class and listen to
Yeah.
our podcast.
Yeah, let's remind people, how does the podcast work? Tell them how it works, Nate.
Well, it's easy, between the holidays and getting sick and some other life unexpectancies, we got a little off track here. But Ben and I are still alive and well. So you can go to our Facebook page, Ben and Nate's Questions That We Ask People on the Internet. We pose questions. You just got to answer them, and then we're going to talk about them. Simple as that. And then you could listen to the end result on Spotify and Apple Podcasts.
Fantastic. So people that like the show, tell them a little bit how they can support what we do.
You can Venmo Ben and I lots of money. But hey, the way to support us is just to simply listen, and share the word. Share it on your Facebook page and answer the questions.
Answer the questions, interact with us, let us know what you like, what you don't like, all that stuff. That's how this show operates. Without you, we wouldn't have a show.
That's right. Although, Ben, I think we would have a show. Even if nobody listened, I think you and I would just do a show anyway.
Yeah, I could see us doing that.
Let's just call a joker a joker. We can do it.
That's right. So what are we at? Episode 32 of Ben and Nate's Questions We Ask People on the Internet. Thank you for listening. Thank you for being around. We appreciate you.
See you soon. See you next time.
See you next time.